Sure.
Hello everyone, welcome to Rehabilitation Sciences Group YouTube channel. And now we are here with another session today, and we have with us Dr. Prabhat Ranjan. Is a well-known, he needs no introduction. He is a physiotherapist senior physiotherapist at AIMS Delhi, and he'll be taking a session today on Parkinson's recent advances, impact of artificial intelligence. And we have with us Dr. Sagun Agarwal. He'll be moderating the session, and he'll formally introduce Dr. Prabhat. So over to you, Dr. Sagun, please.
Good evening, everybody. On behalf of Rehabilitation Science Group, we welcome our esteemed guest, Dr. Prabhat sir. Dr. Prabhat sir is working as a physiotherapist in AIMS. Sir has did his bachelor's in physiotherapy from Government Medical College, Nagpur. He is quite senior from the Nagpur batch, and he is trained in the NDT, Advanced and Basic from the NDTA, and he is an eminent speaker in the national and the international workshop. He takes a lots of workshop onto the NDT, and we welcome you, sir, for today's topic. Today, sir has taken up a very important topic, that is the Parkinson's. Thank you, sir, for giving us time.
Thank
Thank
you,
you,
Dr. Shagun. And it is really a great pleasure to be here at your platform. And I will be sharing some Parkinson's about Parkinson's disease, signs, symptoms, as well as the some of the recent advances and the exercises, what we can do in this. A brief of exercises will be given because it is a large part and lot of exercises are there. So I start with Parkinson's. As everybody knows that it is a progressive disease and it is characterized by shaking, stiffness, difficulty in walking, balance and coordination. Parkinson's symptoms usually worsen over the time, and as disease progresses, there is a decline in the functional outcome, as well as there is difficulty in walking also, talking also. Before that, the subject may face some depression, memory difficulty, and fatigueness is there. And if we see the gender wise, then 50% it is more in men than women, and it has been seen in lot of diseases or a lot of pathology that men are more prone to the diseases rather than women. In even in stroke also we see, even you see that near the current coronavirus, the studies have suggested that more men is affected than women. Women are more safer, and it may be due to some hormonal things, what estrogen and estrogen is there, that may be impacting these factors. Parkinson is known as disease of elderly, but nowadays we can see young patients also of disease, but 90 to 95% cases are of above than 60 years, then 5 to 10% maybe of 45 to 50, but 2 to 3% nowadays juvenile Parkinson's is also seen. The exact cause is said to be due to the decrease in level of dopamine, and sometimes it is inherited also, and gene, it is linked to the gene mutation if we talk of the pathology. And pathology is regarding that dopamine is not released, and the part of that basal ganglia which consists of substantia nigra and substantia nigra, where the what happens that accumulation of Lewy bodies is. A Lewy body is a type of protein which is generally found in the disorder of neurological disorder which is associated with brain. So such as dementia and other things are there. So in that Lewy body increases, it may hamper the release of the dopamine, and which causes the impairment of the motor control in person with the Parkinson disease. So as we know the cardinal symptoms, there is four cardinal symptoms in Parkinson's. One, the commonest one is the bradykinesia, that is the slowness of movement, and it is with the decrease. It is said that there is decrease in the amplitude and intensity of the contraction of the muscle, and that is there is plenty of time lag behind the desire to act and actual performance of a subject, because a subject has a thought in mind that he will perform this task, but he do take some time to actually perform that task. So the sequence of movement, complete sequence of movement is slowed down, and it is called as bradykinesia, and it is known as a negative feature of the Parkinson's because it slows the movement. Next is the muscle rigidity. Rigidity is known as a positive feature of Parkinson's because tone is developed, but the uh, negative aspect is that the tone is developed in both sides of the muscle, that is the agonist and antagonist, which do hinder the performance of the functional outcome of a subject. The patient usually complains of rigidity as a sensation of heaviness or stiffness of the limb. Rigidity may involve the body parts, and they may be there is a three types of rigidity. One is the lead pipe, other is the cogwheel type, and akinesia. In akinesia, what happens that the movement freezes, and there is no movement at all. There is it is difficult to move the limb in akinesia. In lead pipe, there is resistance, and it is a constant and uniform. In cogwheel, as the movement will be there, then sometimes we feel resistance, and some moment we will not feel the resistance. Then is the tremor. Tremor can be divided into the two parts. One is the resting tremor. While resting also, the subject will have tremors. So pin like rolling movement will be there, hand will be shaking while resting also. But what happens in resting tremor, when you will do some function, that tremor will be not there. And another one is the action tremor. Action tremor is there when you do any type of action also, then tremor is there. Then is the postural instability. Postural instability occurs due to the rigidity of the muscle. There is short shuffling gait, as proper muscle action is not there. Then short shuffling gait is there. Then body is stiff, the spine gets stooped, and this also leads to the fall of the subject often. When the postural instability is there, then fall is also associated with the postural instability. Other symptoms are there. As I said, that depression is there. Then probably the subject may face a problem in swallowing, chewing, speaking. We must have noticed in our clinical practice also that when person is speaking with a Parkinson's disease, then his voice is little bit hoarse, or he will be speaking very slowly because he's not able to move the muscles properly. So the speech is also little bit altered due to the muscular problem. So urinary problem or constipation is there. Sleep disruption is there. And as I said, that the gait is slow, stoop with less movement of the hand and leg. So Parkinson symptoms, early symptoms are also there, and this may be noticed by the family members or the near and dear one, those who are associated with the person who is having the Parkinson's disease. They can notice that he is having lack of expression in his face. His movements are slow. He is taking time to perform any movement, and these symptoms are stubble, and slowly and gradually it occurs. He with the one and his family members or a member may feel that while getting up from the chair he's taking time, or going to somewhere he's taking more time, where earlier he used to take lesser time in that performing that activity. So there are symptoms often begin with the progression is there. So progression starts from one side of the body, and then later on to the both side of the body, and it may be severe from one man to another man. It is not that the same progression amount of progression will be there in one person or another individual. It may be different. The progression may be depending upon individual to individual. And many people with Parkinson know that prior to the experience of stiffness and tremor, they have this sleep problem, constipation problem, decreased ability to smell, and restless leg syndrome, because it do affects the olfactory part also. Then the smell problem is there. Parkinson's has been divided into stages, and there has been 5 stages designed by Horn and Yar. They have designed this stage upon depending upon the functional independency of the Parkinson's patient. So if stage 1 is to be considered, the person is able to do his activity. The symptoms are very mild and it do not interfere with his daily activities. Tremors on the or other movement occurs on one side of the body, changes in the posture is there, walking, facial expression occurs in the Parkinson's patient. But he will be able to perform his task independently, but mild interference will be there. Suppose sit to stand, he is taking a normal sit to stand. If you will say, see, then 10 to 15 second a person takes. But here he may take around 20 seconds, but it will be not so significant. So it can be decided given it can be rated as stage 1. Stage 2, symptoms starts get worsening, tremor and rigidity and movement of both sides, walking problem and poor posture may be apparent. The person may be able to live alone, but performing of tasks are more lengthy, difficult. And again it becomes the duration of the time of performing of any task increases, as well as the difficult difficulty also increases. So then also the subject is independent, he will be able to perform that, he will, but he will take more time to perform the task which he was performing earlier. Even in stage 2 it will be more than even in stage 1 it will be more than in stage 2. In stage 3, what happens that a patient can live independently and he can do his all the ideals such as dressing and eating. But here the functional outcome is quite significant. We can judge that patient or the subject is having decrease in the functional outcome or performing of any task. And there will loss of balance also. The movement, the gait is apparent, the slowness is apparent, and due to that, the fall also become common in a patient of stage 3. Stage 4, patient here needs some assistance uh, for performing any of the activity. He will need some assistance, though he will be able to do the work on his own, but he will need assist, such as he wants to walk, then he will need a walker or any other device to walk. If he wants to do some aerial, then he will be performing the task, but he will need assistance there. And here he will not be living independently. So when assistance is needed, we can rate that symptoms as stage 4. Then in stage 5, the subject becomes generally bed bound, and he reads nursing all around his not all around the time he needs the nursing. Wheelchair bound he becomes, what any of the ADL he is not able to perform independently, and he will need a lot of support to perform his activities. So there are motor symptoms, as I said, discussed about the motor symptoms. That was the bradykinesia, tremors, rigidity. These were the motor symptoms. But non-motor symptoms are also there in Parkinson's disease, which develop with in most of the people with other health problem altogether, and it is known as non-motor disorder. And these non-motor disorders are first noticed by the family members, and it may be the cognitive changes with problem of attention, planning, language, and memory. There may be constipation in the subject. He have the fullness of the meal very early. Earlier, he must be taking good diet, but slowly and gradually it decreases. There may be excessive sweating, fatigueness increases, loss of smell, taste, mood disorder, depression, anxiety, irritability, sexual dysfunction, urine urgency, frequency and incontinence, vision problem, weight loss. These are the non-motor symptoms, and non-motor symptoms are should be also taken care of while uh, examining the Parkinson's patient. And to know the basic functional outcome, a scale has been designed in the Parkinson's disease that is known as Unified Parkinson's Disease rating score, which is based on the functional activity of the subject. And this has been here, it has been taken the non-motor symptoms also, motor symptoms also. In non-motor symptoms, mental behavior, mood, in that mental behavior, if we want to see, then intellect impairment, then thought disorder, depression, motivation, this has to be asked. And it is mainly based on interview. The questionnaires are prepared like that, and question are asked. If that suppose you are taking the mental disorder, intellectual impairment, if you ask about his name and all that, so he answers that, then you can say that he is having 0, it is normal. Suppose if he's have you ask some question, then he takes some times, there is a reduction or disorientation is there, or he takes time to recollect that, then you can grade it as 1. You can give UPDR score of intellect impairment 1. Then moderate impairment, where loss of memory is there, disorientation is there, and moderate difficulty in handling the complex problem is there, then you can say that the subject is having the score of 2. And when it is severely impaired, he needs some assistance, or you can say that some type of clue is to be given, then he recalls it later, or there is some suddenly he remembers, and then there is arrest, you can say that he will be having a awkward look, he will not be able to answer. So is these type of mental impairment you see, then you can grade that as 3. And in 4, he will be not answering you, he will be looking he will be staring at you, and he will be not be answering that question. So this accounts till whatever we take there, it has been divided into mental activities also, in that speech, salivation, all those things are taken, even gait is taken. So these type of activities are counted, and this total score counts up to 199. If 199 is represented, then we can say that the patient is having no disability, and he can be in stage or stage 2 of the Parkinson's disease. But if the score falls below that, as per the assessment of the motor activities and the ADL, then we can grade the stages also. If it is below than 100 or 70, then we can grade it as grade stage 3, stage 4. So early sign in Parkinson's, I have discussed this one. So what is the management? When we go through the management, physiotherapy management is there, medical management is there. In many medical management, drugs are introduced by the physicians. Treating physician will take care of that. And as a physiotherapist, we should start the focusing on endurance, using of motor learning principles, mental integrity, dual task training. This dual task training is very, very, very tough for the person who are having Parkinson's disease, but slowly and gradually we can work it out, and make the subject able to perform the dual task. Here I would like to focus on that. We see here we work on a patient's ability to strengthen the muscles, increase the flexibility, to increase his aerobic capacity. But we we are not delaying the progression here. We are delaying the progression in terms of muscular activity, by making the person fit, and to make him or him he or she to perform the ADLs as per the requirement of his pace. So pace is also important, because slowness of movement is there, and we have to take care of the pace also. It is not that we can make the subject work on higher pace, though he cannot. We cannot force that. Whatever the patient or the subject is comfortable, accordingly we should make the conducive environment, and we can make the person do the task. So deep brain stimulation is one of the surgical procedure which is generally done in stage 3, 4, or 5, because there is a lot of impairment, and there is a electrode implanted in the brain, and it is controlled, or the parameters is set through the remote control. And when dosage setting is a very big task, and when proper dose is set, then we can do the physiotherapy, and physiotherapy is helpful after DBS and making the person functional, or to perform the make him perform his aerials smoothly. So I will show you some exercises that what we can do to maintain the musculoskeletal flexibility. Need of thoracic expansion is one of the important thing, because what happens, the patient is in a stoop position, and in stoop position the diaphragmatic muscles or the lung capacity decreases. So we need to have the thoracic expansion for the conditioning of the chest. And also there is psychological decline. This psychological decline is there, then physiotherapy improves in gaining the mental uh, uh, the psychological boosting, to gain the psychological boosting to lead active life, prevent the contracture, deformity, and stiffness. So physiotherapy or the rehabilitation mostly uh, stresses on mobility, flexibility, strength, gait training, aerobic capacity, which ultimately leads to good quality of life. I will show the video here that what how the exercises can be performed. Hello, I am Prabhat Ranjan, and I'm neurophysiotherapy. I am here to explain about some of the strengthening exercises for the Parkinson's patient. Because it has been observed that as the time goes or you grow older, the muscle strength lowers down. And especially in the cases where there is some disease, then it has been observed that it is much weaker than people of similar age in younger life. Parkinson's also, this happens, and the subject who is suffering from Parkinson's are having a weaker muscle in comparison to the other individual who are not having any neurological problem. So we can go for the strengthening program. For that, some points has to be taken care. One is that there should be a suitable environment. For that, we have to make sure that proper support is there, so that one should not fall. Symptoms should be well within the control. Uh, Suppose it is the subject is having on phase, then he will be able to do the exercises properly. But as soon as he goes into the off phase, then he will have the exercises should be done 3 times a week. Take a rest in between a day. One day you do the exercises, the other day you take a rest, so that the muscle doesn't become so much heat. Think one thing or more is important, that exercises should be done at any individual of Parkinson, that the pace should not be much higher or much lower. Whatever pace he is having or he is generating himself, at that pace only the exercises should be done. So now I will demonstrate what are the simple exercises for the strengthening of the muscle. So take a chair. The chair should be firm on the ground, and make sure that it doesn't slip while getting up. Initially, try to have the chair with the armrest, so that the subject who is suffering from Parkinson's can take the support of by lateral armrest in order to get up. This exercise should be performed 10 times at a time, and you can make a set of 10 repetitions. 10 set, take a rest, 10 set, take a rest, and then 10 set. So we can do it this way. take the support of the armrest. With the support of the armrest, the subject get up, and then again he can flex his back and then sit down. Like this, he has to perform 10 repetitions, and slowly and gradually as the time overcomes and he is feeling confident, the subject, then he can stand up without the armrest, help of the armrest, and then sit without taking the help of the armrest. In this, we can adjust the height of the chair where we can start from the comfort level of the subject. If we have to make the height of the chair higher for his comfort level in order to perform the stand exercise, then keep the level of the chair higher. Slowly and gradually we can lower the level of the chair in order to build muscle strength. This may help in developing balance of the subject. So for that, take the support of the chair. Chair should be firm on the ground, not stiff. Stand upright, look in front, take the support of the chair, and then go on your heel, and then slowly come down. Do it for the 10 repetitions, then down, 10 repetitions, and down, then take a rest, again 10 repetitions, then take a rest, again 10 repetitions. This will help in developing the muscle of the calf as well as also help in getting balanced movement by walking. Standing, and that is lateral step up. So keep one of your legs for the stepper, and then with the help of your muscle power, the body weight, just sit up, hold, and then come down. Hold, come down. This also 10 repetitions. Wait for some time, 10 repetitions, take rest, and then 10 repetitions. If you are not able to do this exercise independently, as there are some stages in the Parkinson's, stage 1, stage 2, stage 3. So stage 2 or 3 sometimes may need some support. So keep a chair by your side, or you can take the support of the wall, stand against the wall laterally, and then put the one leg on the stepper, and then with the help of the support, you can do this movement. This will help in gaining the strength of your quadriceps muscle as well as your calf muscles as well as your front foot muscles. So this will help you in gaining the balance also. Exercise is sliding down, or you can see the half squat. Take the support of the wall, put the leg little bit front, and then the help of a body which is upright and is touching the wall, just slide down, and it should be as such that it should not cross over your toe, greater toe. It should be near the toe or about at the parallel to the toe. It should not be in front of the toe. So get down, then up. If any problem in doing independently, you can take support of the wall. Stand like this in the wall, then go up and then down, and go up and go down. This also 10 repetitions, take rest, then 10 repetitions, take rest, then 10 repetitions. The middle of the TheraBand doesn't get squeezed. Make sure that it is not squeezed, and wrap in your hand, put it in a such a fashion that tension is developed in between, tension is developed. So now I think that the tension has been developed. Take the flatter part and then put it in the middle of your both leg, and the tension is developed. So keep your arms straight, upright, and then flex your elbow. In the meantime, try to squeeze your blades scapular blade and then open up the chest. This time, this you can do it 10 repetitions to strengthen the upper muscles. Like this from the back, and the scapula will feel both the scapular blade together. Just open up. The part is strengthening. Put the TheraBand in the middle so that it should not slip. Put your hand straight and then slowly take a 90-degree straight and down, then other hand straight and down, and other hand straight and down. It should be done 10 repetitions, but if you are any of the subject is not able to complete the repetition of the 10, then 5 sets also can be done. Then further we can proceed bilaterally also. Put the hairband underneath your foot, stable, and then bilaterally we can proceed. Then we can also do it for the elbow. Tighten the hairband, and then flex your elbow, straighten up, flex your elbow, straighten up, flex your elbow, straighten up. Same, this way, flex your elbow, straighten up, flex your elbow, straighten up. This can be done 10 repetitions. Not able to perform, then make a set of 5 also, so that slowly and gradually the subject can progress on the 30 repetitions. So now for the strengthening of the lower limb, suppose you want to strengthen the muscles of the lower limb of the right side, and how we can put the TheraBand, we should tie it over the leg which we want to strengthen in such a manner that it should not slip. Then the other end should be at your other leg. Put it in the middle in such a way that attention is developed here. So put it here. You can either you can hold with your hand, or you can just put it underneath the chair. Hold it firmly with this leg, and then lift up, down, lift up, down, lift up, down. 10 repetitions this leg, and the 10 repetitions after tying same manner with this leg, and in that set you can do it for 30 repetitions in a set of 10. Then this exercise can be done in standing position also. We can take a hard chair so that we have to see that it should not slip. Otherwise, on a bar, any bar is there, we can tie this. Just this is for demonstration. I'll show you that we can tie it underneath the chair, one end, and the other end should be tied at the leg which we want to strengthen it in such a fashion that the tension is developed here. Then we tie it out and front, and we have to stand upright, back, back. This can be done for both the legs, one by one, 10 repetitions. Take rest, 10 repetitions, take rest, then 10 repetitions. So when you go through the bands, there are several types of bands. This is the moderate one. We can start with the low resistance band also. The red one is the low resistance, and the yellow one is one of the very low resistance. This yellow one is having very low resistance. Then heavy resistance is the blue, and the black one I'm not having, but blue I'm having. So blue and black one, as per the requirement of the subject, we can introduce the therabands. And this theraband exercise is very good in strengthening, and especially in the subject who are in the stage 2 or stage 3 of the Parkinson's disease, there it can be helpful. Stage 1, it is very much helpful. So we can try these theraband exercise also, but please take care that the patient is stable. The object which we are using is stable. There is no chance of falling, and the environment should be very much cordial for the subject. Apart from training, we can go for stretching also, and stretching of the trunk is very important because this becomes stiff, and as the posture is stooped, then this restricts the movement. So we can do the stretching. A very simple stretching exercise is there. We can lie on the mat. We should lie on the mat. Flex both the knees. We have to flex both the knees, and when we are rotating the lower limb towards the left side, our neck should go towards the right side. Again, if it is going to the right side, neck should go to the left side. This way we can stretch. Other way, we can put the hand underneath the head. Second step, we can do that. This will stretch the pectorals as well, and then we can stretch the lower limb, and then we can take the head to the opposite side. If we are taking the limb to the right side, then the head should go to the left side, and we should make sure that our scapula as well as the elbow is not lifting up, and it is stick to the ground as much as it is possible. There are many other exercises. These were the simple exercises which can be performed with standing and the stretching. Then lot of exercises regarding to balance is there. And for that specific those exercises, we should consult our physiotherapist or the treating doctor so that we can refer to the proper neurophysiotherapist. So neurophysiotherapists are much more oriented about these exercises, and they will guide you well. Thank you. Thank you very much. So this was about the mobility exercises uh, with the strength, and there are a lot of exercises in this. This was just a introductory exercises, and you can modify the exercises according to the stages, which is very important because some patient may not be able to do these exercises, but you have to do the continuous assessment. So see that mobility and the flexibility accordingly, then advise the exercises. So this is important in the Parkinson's patient. The next is the artificial intelligence part. What is artificial intelligence? So nowadays we are very much oriented to this artificial intelligence. It is nothing that whatever we are using, mobile, computer, anything, any of the gadgets, these are the based on artificial intelligence only, because it is a device which perceives its environment and takes action that maximize the chance of successfully achieving its goal. It is a more elaborate definition as a system ability to correct, interpret external data, to learn from such data, and to use those learning to achieve specific goal and task through flexible adaptation. So in near future, we may see that our treatment protocol and all that may include these type of artificial intelligence, so that better outcome may be there and better interpretation of data may be there, so that better research facility can be generated through these. So before, how does it work? Before that, we can do the testing of the subject. We can identify the functional outcome as per the United Parkinson's Disease Rating Scale. Then we can do that testing through work balance test, time up and time go test, time up and time go test that a person standing and then walking for 2 meters and then coming back, the time he is taking. So these tests can be done so that proper assessment should be given, and whatever pre-treatment and post-treatment, what is your finding accordingly, then we can say that artificial intelligence is impacting in controlling the functional outcome of the Parkinson's patient. So this how it is works. So there is a virtual treadmill. I think an environment is virtual environment is created. If you will see, then a 6 by 10 foot machine is there, treadmill machine. Three, it's if you will go to two numbers, so three 8 by 8 foot rear projection screen is there, and it creates an environment that as such the subject is walking on a surface where it is odd or even, so that the balance is generated. And when balance is generated, slowly and gradually the balance is improved. Initially there is a posture instability, then harnessing has been applied, and slowly and gradually that harness with a simple task, he is able to perform the dual task. Then without harness, he or she is able to walk. So we can see this in this video. This will give a clear picture that how it works.
Sandy Williams is buckled up and ready for action. It looks and feels like she's part of a video game, but it's actually high-tech rehab for her Parkinson's disease.
We know in neurorehabilitation, you have to challenge patients for them to get better. And so this provides a very safe environment for that to occur.
The virtual reality treadmill has two belts, one for each foot, and a base that moves to mimic different surfaces. It can also react and adjust to a patient's movement, and a wraparound video screen completely immerses the patient into a real-life scenario.
When I go over like a little hill, you feel it in the machine.
Rather than just having the patient walk or an individual walk up and down a standard biomechanical track, now what we can do is we can change the environment in a very dynamic fashion.
Special programs are designed to work on specific skill sets while providing positive feedback. During weekly appointments at Cleveland Clinic, Sandy works with her therapist on gait and increasing stride length by touching her toe to a box. Other times, she's asked to target birds and butterflies while walking.
This target task is the dual task.
And
So
it satisfies that competitive spirit.
I enjoy
so
doing
while improving the gait, she is doing the dual task. It is improving the balance also.
The part, but I do enjoy the challenges. Can I get them? I know once I slow down, it could come to the point where I couldn't move. So I'm willing to do whatever
Now
I
you can see that
to
she's
keep
walking
myself
without the
going.
harness
At Cleveland
also.
Clinic, I'm Erica Foreman.
So this way, it may help in patient developing the balance as well as improving the gait. And it happens with that concept of neuroplasticity also there, that as if we are working continuously with anything, then the that mind takes it up, and it helps in generating that movement. So concept of neuroplasticity is also applied by this virtual reality, as a lot of training is there, intense training is there, and it becomes challenging also for the patient, as the computing gaming is there, brain training is done through that, cognitive skills improve, and this helps the patient improve the functional outcome. And how it works, we can see that what is the theory behind that, what are the components which help in getting these things, that is the accelerometer, gyrometer, and the manometer. So we can see the other video. So how it has developed the sensor, first the wireless sensor were there, and a wireless sensor, then wireless sensor was applied in the subject.
The more I exercise, the better I feel.
Like most Parkinson's disease patients, exercise eases Mary Spletter's tremors, halted gait, and lack of balance. She recently took part in a UCSF study to see if special video games could replace her regular exercises.
Let's go.
The therapeutic games are the result of a marriage between game developers and scientific researchers.
Well, UCSF had developed a series of exercise programs for patients with Parkinson's. And they asked us if we could actually make a video of it. And we said, you know, there's this new thing called the Wii. Why don't we make interactive games?
UCSF researchers thought video games might be a welcome change of pace from physical therapy, which can be tedious.
People very much like doing the games. They found them engaging, fun, and therapeutic.
But developing games that would know if patients were using the right muscles in the right way was tricky. Health games need to detect a player's movements much more precisely than their consumer counterparts.
So there's 3 different devices that you need to be able to sense where you are in a particular space. One is an accelerometer. Am I moving a particular direction? Another one is a gyroscope, which is which direction am I pointing? And then third, you need something like to say, okay, I need a rock solid north, and that's a magnetometer.
These 3 technologies enable smart devices to do this. To make the technology more accurate, the developers created suits with 9 built-in sensors.
They were a big pain.
The battery-operated suits were awkward and cumbersome, so the developers turned to camera technology.
It's bathing you in infrared light and then taking that information and using some very clever software to say, you just raised your hand.
The camera technology does not need to be worn, but it's not as accurate as the sensors.
Each one has their pluses and minuses, and we're looking at actually trying to perform a fusion between those 2 technologies.
The UCSF study showed that despite their physical limitations, Parkinson's patients could successfully play the games at home, and they did them more often because they enjoyed them and they helped.
It was a fun way and an easy way to exercise right in my own front room at any time. I felt better. I felt more normal, more fluid, looser.
In fact, the study found that after playing the games for 12 weeks, 65% of patients had longer strides, 55% had increased gait velocity, and 55% also reported improved balance.
The hope is that if we can engage people in physical activity early in the disease course, that we might actually be able to delay progression.
The therapeutic games could be available to the public as early as next fall. For Smart Planet, I'm Sumi Das.
So with this technique, we saw that even the research also supported this, that 55 to 65% of the cases had good impact in their balance improvement, stride improvement, functional outcome improvement. So next is that these things improves the our tremors, gait pattern, movement, and all that. And for that, measuring nowadays in artificial intelligence, if we see, so for measuring the tremors, now the equipments are there. It is applied over the hand, and we can measure the tremors, that how much tremors is there in a minute or whatever time we decide. So, and after the treatment, pre-treatment, we can get the accurate data that how much it has improved in terms of tremors and all that. So slowness of movement, it is applied over the fit also. So how much time he takes in initiation or for walking. So this can be adjusted through these smartphone motor test application or hand tremor test, because these may give the accurate data, and this may help us in getting good research, quality research with the use of artificial intelligence. So I think that in coming years, with advancement of technology, the measuring of Parkinson's rehabilitation will grow significantly for better outcome, and to our ultimate goal is to make them live a good, active quality of life. So thank you for the patience listening. Hope, I think it would have helped you all in getting the concept. Over to Dr. Shagun.
Thank you, sir, for such a wonderful and enlightening lecture. And sir, there are few questions here. People are asking that what is the best way to handle tremors? Because we know that these are the main problem in Parkinson's. So what do you suggest that to handle tremor and rigidity for physiotherapists?
So when there is a functional tremor, so action tremor is there. If the resting tremor is there, then simply if function is there, then tremor is absent. But functional tremor is there, then we should apply the weights over the hand so that the tremor is controlled and the patient can do some coordinated movement and the sequence of the movement may increase. So weight application is important in that.
Very good, very good. So, sir, you said that UPDRS is the good tool to assess the severity of Parkinson's. Do we need any certification for that to
Sir,
assess?
regarding certification, I think Movement Disorder Society is there, and I think they are conducting some courses, not in India, I think abroad they are conducting, as far as I have seen or researched, that they are conducting the courses, because it is a vast list.
Okay.
And for that you need, if you want to go for the certification, definitely it will be a welcome thing, and one can go for that certification, because every aspects of the Parkinson's disease is considered in that to count that, because 199 score is there, lot of activity is there, activity regarding gait, activity regarding your muscle rigidity, with posture analysis, everything is there, and a lot of questionnaire are there. So it is a vast thing, and we can go for that if any of the society is providing that. But basically, I've heard that Movement Disorder Society is offering that courses.
Definitely, I think if we learn in that way, it is a really complicated one to perform,
Yes, yes, yes.
and we must learn that rather than just having it practicing as without
Theoretically,
any.
we are doing that, but practically, if we are going to implement, then a lot of things there is to be in mind. Suppose you have prepared the question and all that it becomes easy. But when actually we are making the subject perform, how to make the subject perform is also a difficult task. Sometimes it becomes difficult, because in stage 3 and stage 4, stage 3 to quite okay, but 4 and 5, it is very difficult to get them perform any task, and especially they are in off phase. Then, because there is on and off phase, there is till the medicine acts, the person is able to do the movements quite nicely, but as the wearing off of the medicine is there, patient goes into the off phase and he literally freezes. If akinesia is there, then at that time the subject will have problem in doing the functional activity.
There was one question, sir, that can we use fistball for Parkinson's
It
patient,
depends
and
upon
what
the balance.
exercises we can do?
It depends upon the balance and postural instability, stability and instability of the subject. You have to assess that, and accordingly, as after the assessment, you can use the Swiss ball. Not a problem. Basically, in Swiss ball, if you need to go for that, then extension of the spine is very important with the rotation, because there is a stoop posture, as I have shown in my video. Also, one exercise with the wall. So why I took the wall? Because we have to make our chest wall open, that our spine should be straight. So we should take the support of the wall and then slide for having the better balance. So that exercise you can apply in the Swiss ball also, but you have to see that the subject is having good stability in that. Balance is good.
Dr. Sagun, you there? Dr. Harpreet also is there, and if you have any question.
सर बस ये पूछना था सर, ये जो ओल्ड टेक्नोलॉजी है इंडिया में अभी अवेलेबल है सर सब कुछ?
ओल्ड टेक्नोलॉजी मींस
सर ये न्यू टेक्नोलॉजी जो
न्यू
टेक्नोलॉजी की बात
सर इंडिया में तो अभी शायद नहीं है, इसलिए मैंने बताया कि आने वाले समय में हो सकता है कि हमारे लिए महत्वपूर्ण हो जाए. और the days are coming of virtual days. Now we are connected in COVID era virtually.
Yes.
Isn't it? So that days are coming up virtual. So
we should promote our physiotherapy.
Yeah, that's why I have taken this topic, that one should be aware of the things what is there in the world going on. Slowly and gradually it will come into the practice. It may take some time, but I think it will come into our practice.
Thank you, sir. Thank you. It's a well explained lecture, sir. और बहुत ही अच्छा लगा, बच्चों को भी नई चीजें सीखने को मिली, प्रोफेशनल्स को, और डेफिनेटली हम लो कॉस्ट टेक्नोलॉजी को लाने की कोशिश करें इंडिया में. ये एक सबसे अच्छी बात होगी.
इंडिया में हमारे I think it is the best part that our Prime Minister Modi has taken the initiative of Make in India, and sometime we may see that these things are made in India with low cost, low and effective cost.
Yes, sir. So with this note, we would like to thank you so much for being on this platform, and you accepted our invitation. You enlightened with your knowledge, and new things, and we are very thankful to have you on this platform.
It
And
is always
definitely
a pleasure to connect with Dr. Dharam Pandey, Dr. Shagun Agarwal, and my near friend Dr. Harpreet Singh.
thank you, sir. Thank
साहब
you.
सर
बाय,
हम
आप
आगे भी
लिखते रहें.
चाहेंगे कि इसी तरीके से लेक्चर्स लेते रहें सर आप,
And
और इसी
definitely,
तरीके से जुड़े रहें.
and definitely we will invite you again कि आप आए और इन चीजों से enlighten करें हमारे audience को और लोगों को. So with this note, thank you so much, sir. Thanks.
Thank you. Thank you.
थैंक यू सर, थैंक यू.